So March is Women's History Month, and specifically on March 8th is International Women's Day. So in light of that, I was recently in a surgical case, and realized that there was a student in the room that was another female. And I'm always excited when I see women medical students that are rotating through surgical rotations. She wasn't with me, I'm an orthopod, she was with a general surgeon. So I took the time while I was in the room to share some things with her, specifically in front of the staff. What I have still noticed, and I'm still triggered by, is when I see male staff members, not all of them, some of them, not taking the time to teach them the way they would a male resident. So, peep the game. For female residents, one, you need to get my book, The Rules of Medicine, for any medical student or resident. The Rules of Medicine teaches you some basic things that you need to know that you may hear, you may see, but some of the things you never think about that are going to help you get through your training. But for women, I'm specifically talking to my female medical students and residents. When you are in a field that is a surgical field, I don't care if it's ortho, general surgery, OB-GYN, urology, neurosurgery, plastics, ENT, whatever it is, there are some things that you should know. Number one, specifically for medical students, always beat the staff into the room. You should also know everything about the patient before you go into the room. When you are doing a surgical case, not only seem interested, but ask questions when appropriately. Like when you need to ask a question at the appropriate time. Sometimes it's the wrong time. If the field is full of blood, you don't want to ask a question at that time. And then get aggressive. You want to be able to do things. You want to do procedures because your male counterparts, I promise you, are going to step up to the plate. Now, if you think that you want to go into one of those surgical fields, you need to also show up educated, that you've read about the case, what you're doing, and that kind of thing. You will also stay in the surgical room with the nurses who will also teach you some things. Nurses are going to be your best friends when it comes to some surgical cases and procedures to even show you some things. You take the patient out of the room, and then you make sure that you may be around while they're dictating the note and or while they're changing dressings or whatever else, so you can learn more. More than anything else, always seem engaged if it's a staff member and you're someone that wants to go into a surgical field. It's not always going to be great people. They may not always want to see that you are going to succeed in surgery, but have an attitude that you can do this and show up that you want to be there. Good luck to you guys.